Hello and welcome to this special show on Rajya Sabha television. I am Vishal Dahiya and here we take a stock of India's battle against COVID-19. Now today we have a special guest with us and we'll try and understand where have we reached in our battle against this particular pandemic, what is being done on the ground and what are the plans vis-a-vis vaccine as well as drugs for this dreaded disease. Now we have with us Dr. V.K. Paul, who is member NITI AAYOG, leading the health vertical. He is also the chairman of the National Task Force on COVID-19. Welcome to Rajya Sabha television, Dr. Paul. And let's begin by taking stock of the situation. Where do we stand specifically, India, as in this fight against COVID-19 so far? Now, it has been almost 7 to 8 months. We've done fairly well, but what does the numbers say and what is the real ground situation?
Well, we are at a point where we have had a total of about 7 million cases so far. But we are also demonstrating extremely nice recoveries, close to about 6 million. Our active cases are about just under 9 lakh. We have done reasonably well compared to the world. For example, if you look at the total number of cases per million, the world average is 4,700, around about that. It changes, of course, it's dynamic. 4,700. Where we are today, 9 months into the pandemic, we are about 4,900, just below 5,000. So just above the world average, and for a long period of time, we were well below the world average. You look at the deaths. The deaths per million in the world are to the tune of 137 per million as an average in the world. Where are we as a country? We are at 77. That's about half in terms of the world average of the deaths attributable to COVID-19. Now, if you look at case fatality rate, the world is about close to 3%. We are about 1.54%, roughly half. So on mortality, we have done very well.
Okay.
In terms of total number against the population, we have done extremely well on that count as well. Now, over the last week or so, we think there is some stabilization of the pandemic. We reached a peak of daily cases to the tune of about 95,000 or so per day for a couple of days, for a few days. But today we are down to less than 75,000, about 70,000 in that range. So we think we may be experiencing sort of a plateau.
Okay.
But you know, there are uncertainties as we move into the future few months because of winter and other issues. We'll come back to that.
Okay.
But as of now, the numbers seem to be stabilizing, and this could probably be real. Only time will tell the truth, but it could be real because our mortality, the deaths have also stabilized. Still a couple of weeks ago, the deaths were above 1,100, close to 1,200. Now they are something like 926, 914, that below 950. So that also has stabilized. And this is also important that our testing rate and testing coverage has been good. It's extremely good, in fact.
Okay.
And concomitant with these changes, the test positivity rate, which indicates how much density of infection is also stabilized to around just above 6% or so, around 6%, which used to be somewhat high. So on all accounts, there seems to be some stabilization post-monsoon, but that's the present situation. We have a huge concern about the weather change, the winter, and the festival season, and I'm very concerned about that period.
Okay.
And we need to talk about
Okay,
that.
we'll definitely come to that aspect as well as to how to navigate the next few months or the next few weeks as well. But since you mentioned the testing strategy out there, I'd first like to bring that in, you know, the 3 T's: tracing, tracking and testing as well. Now, that particular strategy has been quite dynamic from the beginning as well. We've responded to, obviously, the way virus has behaved. But of late, one concern has been that is the testing strategy target-driven, or it has to be, sort of a dynamic in terms of looking at it from the positivity rates?
Well, testing has a few underpinnings in terms of how you approach an individual and decide to do a test. Now, remember, testing has two broad uh, purposes, practical purposes. One purpose is to identify an individual who is positive and therefore is harboring virus, and this person needs to be watched first and foremost for emergence of infection, symptoms, and if they are severe, a lot of action has to be taken, whether we in the early stages look after at home in a protocolized way, or we move to a hospital. So that's one aspect. That individual has to be cared for once somebody is positive. But the second part is extremely important, that once you detect a positive case, then this positive individual has to be isolated from the rest so that he or she does not spread infection to others. That's a very important part, because if you allow this person to spread infection to others, the pandemic will move. We need to suppress. And how do you suppress? At least now you know who is spreading, and therefore that person should be isolated. And the second part of that is that person who is positive may have come in contact with some people, a lot of people, family members, office colleagues, and other people. And these people are now contacts. And some of them may have picked up infection from this individual. So contact tracing becomes an important part of our strategy, again, to contain these individuals away from the rest of the society, and you watch them for their sickness. So testing, therefore, has two purposes. One is targeted toward control of infection, suppression of the chain of transmission, and that's a surveillance strategy, containment strategy. And testing also leads us to the care of the individual. So these are the fundamentals for which you do the testing. Now, when you perform these testing parameters, then we have to keep in mind how we spread the net and how we build a protocol around which testing has to be done. So for surveillance purpose and adequacy, there are two provisional benchmarks that you work with. These are WHO indicated benchmarks, that you make sure that you are conducting tests at any time on a daily basis to the tune of at least 140 tests per million, which means that you're throwing the net reasonably wide to catch the people who could be positive. So this is like a baseline surveillance, baseline catch that you are doing. But imagine when you throw this net, half of the people are coming positive, which means the net is not wide enough to catch people. So then you bring in the next parameter, that your positivity rate should be below 5%. Definitely below 10%, preferably below 5%. And that ensures that my net is wide enough to catch maximum possible individuals. Because, and even when the positivity rate is well below 5%, let's say 3%, I will still be spreading the net to the tune of 140 per million on a population basis as the minimum surveillance system. Fortunately, we are doing very well on this. I just now told you that our positivity rate is 6%, which is fine nationally. Of course, there are pockets and states and districts where it's significantly higher, and we are concerned and we're tracking every day. And on the other score of 140 per million baseline, we are actually testing 860 plus tests per million. We are typically now performing 1 million tests every day. So the point essentially is that our testing strategy is strategic, testing strategy is based on science, and it is based on our two efforts to catch the people who are positive for themselves and to catch them in terms of their origin and their contacts, and then building containment zones and isolating such individuals. So it is strategic, but it has some benchmarks that should be met.
So the testing strategy is obviously strategic, and trying to be in tune with the overall strategy to contain COVID-19. But Dr. Paul, let's now come to the real important question, and that is obviously there are several unknowns when we talk about the next few weeks or the next few months, and there are quite a lot of combination of factors there. Reopening. The unlocking, the festival season, the winter season as well. So, how is those who are dealing with this particular strategy, people like yourself who are involved with this entire policy making or ensuring that all things are in place? How do you guys plan to deal with the situation in the next few months, which are really going to be crucial, as you said, in terms of numbers as well?
Truly, the next few months are crucial. If you look at the scene in the West, with countries that are already entering winter season, you can see that almost all these countries are showing another peak. They had declined, they were stable, and now they are into peak. Much of Europe, for example, and these peaks are higher than the original peaks, at least in some countries. Very worrying. Spain has got, capital has gone for a lockdown. Such is the situation, and UK is shutting down. So clearly, respiratory viruses have a propensity for severity and propensity for spread during winter months. It's well known. खांसी जुकाम जो है वो सर्दियों में ज़्यादा होता है. Flu happens in winter. 1980 epidemic in winter phase was much worse than the original phase. So we are worried on the weather front. We are also worried that this is the season when all of us have a spate of festivities. We have Chhat, we have Dashera, Diwali, Eid, Christmas, we have New Year, and so on. So this is doubly worrying because events that bring us together in crowds are potentially super spreading events. We are knowing increasingly now that perhaps the spread of infection happens more in some situations than in some general settings. And these events, these situations are clearly, from the point of view of pandemics, very dangerous. And remember, 90% or more amongst us today, nationwide, are still susceptible. We do not have antibodies. We know it from our sero survey. Yes, in some dense population, maybe it is 70, 80% people who are susceptible. But in general, 9 out of 10 are still susceptible. And then you have the winter season, and then you have festivities, people coming together. It's a dangerous situation. And on top of that, part of North India, including Delhi, would experience a higher level of pollution potentially, as it happens every year from time to time.
Okay.
And therefore, there are concerns.
So what needs to be done, and what is being done, Dr. Paul?
Indeed. So we've taken this scenario into account, and we have revised our understanding of the needs for surveillance, and revise our estimates for looking after a higher surge of cases that might emanate during this phase. For example, in Delhi, we said that what could be the level of surge that we should be prepared for. So you remember there used to be about 4,000 odd cases in the last peak, 4,200. So we said, okay, in this period, let's be prepared for a surge of at least 15,000. We don't know it will happen. We are not saying it will happen by any estimate. We are saying let's be prepared that with these uncertainties and adverse situations that might emerge, weather, winter, festivities, and also people coming from outside Delhi, we said, let's be careful that in Delhi we are prepared for a surge of about 15,000. So we do a common sense, but based on common sense approach, a pragmatic approach, but based on scientific underpinnings to make an informed choice to plan for the health system preparedness and surveillance preparedness. But also, one important part of the strategy is that don't leave it only for the consequences to be handled. So the preventive part in terms of individual behavior has been brought center stage. Okay. Why do we want to see such surges at all? When we know winter is coming, such events are coming, should we not work with prevention? Should we not reduce this exchange of virus from one to the other? We know that works. There is no doubt that works.
So that is why the awareness campaign becomes really important there?
So that becomes an important strategy, that we don't want to end up with higher surges and then consequences of hospitals and ICUs filling up, and mortality going up, and having a specter of having lost this plateau again to a peak. Best to prevent. And that's in our hands as a society, as individuals, as families. So that's part of the fundamental part of the approach
What's
in
the
these
focus
markets.
of this awareness campaign which we're talking about? Since you're saying that behavioral change becomes really important, and that's something which people like you and others, epidemiologists, virologists, everybody, public health experts have been pointing out that behavioral change is a very key aspect of this battle against this pandemic.
So I explained to you that you see we can keep preparing for any number of hospitals, any number of that's not easy. There's no end to it. When 90% population is susceptible and the virus loves people. So it is better that we invoke the fundamental principles which protect us as individuals from giving infection to others and receiving infections from others. And that boils down to the three themes which the Honorable Prime Minister has been highlighting and is now part of the major campaign that has been launched 2 days ago through the aegis of the Honorable Prime Minister. Now, these are please wear a mask. And when you wear the mask, please wear it properly. When I'm in the presence of anybody, when I'm in public space, when I'm even in the family, I should wear a mask. And I should make sure that this mask covers my nose, covers my mouth, and I protect myself. I do not remove the mask to speak because that takes away the value of the mask. I get used to speaking like this when other people are around. So wearing the mask, 100% wearing of the mask, all the time wearing the mask.
Okay.
This is the best protection because I am not giving infection to anybody now, and I am also impervious to receiving infection from others. And I'd like us to wear good quality mask, preferably surgical mask, and those who are involved in working with other people, and even N95 mask in certain conditions, as we state as protocols should be followed. So that's the first strategy. Second strategy is that I should be away in common places, away from each other by 6 feet. Do gaz ki duri. The virus finds it difficult to move from one person to the other. It cannot traverse 6 feet, but it can traverse when you sneeze or you cough or you talk, 6 inches or 8 inches or 2 feet. It can. So, 2 गज की दूरी जब लोगों के साथ हैं तो उतना दूर होना चाहिए. Second strategy, make it difficult for the virus to catch us. And the third strategy is because hands touch secretions, hands come in contact with the oronasal passages, and therefore, and from the surfaces. So you wash hands or you sanitize hands from time to time using either a sanitizer or you go out for a while and wash the hands with soap and running water. These three strategies will perhaps reduce the chances and risk of picking up infection almost entirely at individual level. And at population level, introduction of masks and universal mask wearing can reduce the spread of infection to the tune of 36 to 50%. Now, this is, I would say, the most important strategy at this point in time because the other strategies, in any case, we are working for preparedness for the hospital, testing, surveillance. We can intensify that. We should intensify that. We must make it perfect. But this one is the margin where there's so much room for improvement. We can move from 40% compliance with masks to 100% compliance with masks. How many more hospital beds can you create? Where are the people to look after sick individuals? So in this situation, the most important responsibility of citizens and all of us as a society is to conform to COVID appropriate behavior. The three behaviors that we talked about. On top of these, we should be clear of looking after the elderly who are particularly vulnerable. We should use Ayurveda immunity boosting products because they are good in general for us to be safe. And I think we can carry through the next 100 days or so up to the Republic Day. If we stabilize this plateau and bring it down, what a wonderful thing to do. But we have a real risk of losing this momentum. And I appeal to all of us to please embrace the three messages which the current campaign, we believe that will be an unprecedented campaign led by the Honorable Prime Minister, will will promote, and we should be part of the journey.
Okay, definitely. The behavioral change is a really, really important aspect there, as Dr. Paul is pointing out. And before we move ahead, we would also like to remind you once again that these three principles, as Dr. Paul and the authorities are pointing out time and again, wear a face mask, wash your hands, and practice distance, social distancing, physical distancing of at least 6 feet. Now, let's come to the other aspect, Dr. Paul, and that's equally important. We've spoken about the public health approach, the behavioral change as well. That is, the authorities are doing their bit and the individuals doing their bit. But let's also talk about the vaccine development, something which has been going on, for quite some time now. What's the status as far as the vaccine development, the COVID vaccine development, and India's part there is concerned right now?
Well, I think India is in a very fortunate position with regard to the vaccine access eventually, because we have a huge industrial enterprise which is capable of producing huge stockpiles of vaccine. We have been giving vaccines to the world for childhood immunization with a lead player. Maximum vaccine supply happens from India. We also have a scientific enterprise through our CSIR, through DPT laboratories, and through ICMR system, where we can create products which will become vaccine and test different vaccines in different way. We have a robust regulatory system also, and we are used to providing research and capability and facilitation for vaccine. Now, there are 3 vaccines on trial in Indian soil. 2 of them are indigenous. They are in phase 2. We would have phase 2 results in about a month or so. One vaccine, which is the Oxford AstraZeneca vaccine, is in phase 3 trials. It will take, I think 2 to 3 months for results to come. And as the Honorable Health Minister has stated a few days ago, we could see a vaccine being made available in the first early part of 2021. And in order to take it to scale in a systematic way, the plans are afoot to see how to prioritize delivery of these vaccines to those who are more vulnerable when the supplies are limited. Once unlimited supply happens, it will be as required. But in the beginning, it will be targeted to those who need it more in terms of their risk of mortality.
That's a really important aspect, and that's something which I would want you to explain to our viewers a little more in detail. That's about accessibility or equitable distribution as well. I believe there is a strategy in place. There is a committee, high-level committee, which is monitoring all the developments there and ensuring that the strategy is put in place well before the vaccine candidate is approved, the final vaccine candidate.
Indeed, and that's the way we are working. You have rightly articulated that a committee, interministerial group, is looking at it, but there are uncertainties. We still don't have a vaccine today. They are all in trial. We don't know whether they will all succeed. And once they succeed, we do not know, what exact stockpiling capabilities would be there. We have some scenarios. So I would like to just assure the viewers today that India is in a good position. We have our own vaccines, our own manufacturing capacity, and in a very concerted, systematic, scientific way, an approach is being taken to scale up the vaccines as they appear on the scene. But remember, today there is no vaccine that is licensed, and therefore it is hypothetical. We hope the vaccines would work. We hope the vaccines are efficacious enough for them to be taken to scale. Imagine if a vaccine, one of these 3 vaccines, is the kind of vaccine which does not give immunity to more than 20% people, then it will not go for scaling up. And therefore, it cannot be taken for granted. And there, I would like to make my last point. That is, come back to self-protection. The social vaccine of proper behaviors to protect against COVID-19 infection is your vaccine today. Tomorrow, when that vaccine comes, we'll be happy. But we can live with coronavirus by embracing the appropriate behaviors, which we have highlighted. And in particular, in the next 100 days, this is so very important. And I appeal to you that let's adhere to those practices. vaccine, Indians are lucky. You will have the vaccines earlier than perhaps many others. We will be supplying vaccine to the world. It is India's vaccines are for Indians, but also for the world. And this is the endeavor with which we are moving forward.
Okay. Thank you so much, Dr. Paul, for giving us that holistic view on India's battle against COVID-19 pandemic. As Dr. V.K. Paul pointed out clearly, the approach on all aspects, be it the testing strategy, the public health approach, or development of vaccine candidates and its equitable distribution. But one aspect which stands out really in all these scenarios, that is the COVID appropriate behavior or the behavioral change which all of us, you and me, will have to bring in our daily routine. That is adhering to 3 basic principles: wearing a face mask, washing our hands, and maintaining physical distancing of at least 6 feet in our daily routine. If we adapt that, if we adhere to that, perhaps we will be able to defeat COVID-19 much earlier than it intends to. Thank you so much for watching Rajya Sabha Television. We'll come back again. Till then, keep watching RSTV.